this system is fucked. This is fucked.
Yeah.
Like there's
Like
no
the first denial is just to see if you'll work harder.
correct.
Like, can we just say no? And like,
Correct.
Well,
just
and now what they're doing with, especially with AI, is that it doesn't even get denied by people anymore. It's just auto denied for a majority of
God.
cases. But there are processes too. Like I know at my end, because I have spent a lot of time trying to figure out how to maneuver the insurance, even though I don't bill insurance. I'm not an provider precisely for that reason, because I don't
Right.
want to fight to get paid $50. I would
Right.
rather get paid what I'm worth and then comp my time for the people that need it. And so, there are ways to bypass the system. Like what we do is we put it through, and if it gets denied, I don't even bother with the paperwork anymore. I don't even bother with the paperwork to prove. I go straight to a peer-to-peer review, which is me calling the insurance company, spending 30 minutes on the phone on hold, and then getting a doctor that works for the insurance company who goes, "Why do you think this is necessary?" And I say, "Because this patient looks like they have a tumor in their lung. They need a CT." And they go, "Sounds good. It's approved." Like, it's
Jesus
literally
Christ.
1 to 2 minutes of my time once I get that other doctor on the phone who's a human being who's like, "Yeah, obviously this makes sense." Sure. But I have to sit there for 30 minutes and I have to make the effort to make a call.
Hi, I'm Cheryl Medeiros.
And I'm Colleen Hungerford. And this is We're Doing This Right? A podcast for the whole woman, mind, body, soul, and business.
It's humor infused, as real as it gets, inspiring, and you'll walk away with real usable tools for life and business.
If you love what you're hearing, please share with a friend, subscribe so you'll never miss an episode, and rate and review whenever you listen.
So find your earbuds, lace up your walking shoes, or cozy up with a beverage of your choice. It's time to dig in.
Okay, we're here. Welcome back. We're doing it right here in San Luis Obispo. What's happening in Carmel, Indiana? You doing it right there?
I'm doing it right. I called Cheryl yesterday in a mental breakdown and she didn't answer the phone, but it's okay because I got through it. And then I left her a dramatic voice message this morning or yesterday.
I think it was yesterday. I don't know. The 24 hours before this last 12 hours was really crazy for me.
But everything's fine now. Everything's always going to be okay. It's just sometimes you have those moments of like, what the fuck? And then you just keep going. So that's basically how we're doing it right now. Just what the fuck and then keep going. We have an amazing returning guest and we're so excited about it. Go ahead, Cheryl. You do it.
Dr. Jenny Bennett is in the house. Dr. Jenny Bennett is the owner of ARIA Integrative Medicine in Seattle, Washington. Did I say that all right?
Yeah, you said it right. I mean, you could just tell them, that you're my friend and I've known you since I was like 7.
I know. I try to give you some credibility. Jenny also is my soul sister, my neighbor from growing up. We were children and we caused havoc all over Amador County together. And we were on the same relay team. She also was my biggest competition swimming. And she's just like a trusted resource and friend my entire life.
I love it.
I think, now that I think back, I don't think we were competing with each other. But like when I look back on it now, now that I'm 40, it didn't feel like it was that much of a competition. I feel like we were working more together than we were.
Yeah, we were always on the same team, like big picture team, relay teams. And like, I think we did both have our strengths and then we weren't always in the same division. So that helped. And we just made each other better because, well, Jenny's really fast. I'll keep up with Jenny,
Cheryl you were better than I was. Let's just be real.
I don't.
But you know what?
We had our moments.
I love that. Like, I think when we talk about competition, it always becomes like it kind of feels like a mean-spirited thing. But I think like kind of what you guys are talking about, this like almost like congenial competition, right? Like where like there's an agent here that's in the same brokerage as me, and I have a competition in my mind going on with him. Where it's like he gets a listing, I'm like, oh man, Brian got a listing. I want to get another listing, and it's not because I don't want Brian to win, but it's like that kind of fun,
it pushes you
competition game that like helps to push you, right? Makes it kind of interesting. I love that for you guys.
Yeah, that's good.
It's pretty. And I was thinking more about you recently, Cheryl, because I am actively training for a triathlon right now.
Yay.
And I know you've done them before, so I need to touch base with you on this on a different plan. But I got back in the pool for the first time in like years. And we're gonna do a sprint triathlon, which is like a 750 meters. And I looked at like what the average time was for people swimming the 700 or whatever meters it is, was like 10 minutes for people who are training, like that's a good time. And I got back into the water and did it in 13 minutes without swimming it for like 6 years. I was like,
Good
damn,
job.
Wow.
I still got, and my poor friend who's doing it with me is like learning how to swim partially. And so he's like dog paddling, and I'm just like, I'm gonna like jump in and swim 700 meters right now in 13 minutes.
Swimming is so hard. It's
It
really
is.
hard if it's not something like anaerobically, it's like a different beast.
Yeah.
It's
And we
tricky.
have muscle memory, Jenny. Like every time I get back in, sometimes my form feels a little funky, but I still like, I'm the best in the pool when I get in the pool. Still, after like training once or twice a year, and like I'm the best in the pool, which is cool. I like when someone else is fast because then it pushes me to go a little faster, which is nice. But most people that do triathlons, swimming is their weakest link. And so you will find when you do this race, you will get out of the pool or wherever, if it's an open water swim, ahead of everybody else. And then if you're anything like me, I'm very slow on land. So
no, like, because you talk about the muscle memory with swimming, like when I run, it's like my body is like one of those, you know, those like floppy air things that are like at car dealerships. I don't know, like nothing is working. I feel like every bone in my body is breaking. I'm like, what am I supposed to be doing?
Yeah.
Oh my God.
I always like, I would finish one of the first done with the swim, and then I can hold my own on a bike. Like I'm fine on a bike, mediocre. And then I fucking suck wind on the run. I end up walking a lot of it. My knees simply cannot run. I just can't do it. Even at like my most fit, I just, not for me.
I'm pretty positive I can swim a mile faster than I can run a mile.
Oh, wow. Yeah.
I think I'm close. Maybe not quite, but like it's that bad.
Yeah.
I'm pretty much fast walking. I'm barely running. It's like that.
Yeah.
I think.
I'm here for it. Same. Well, Jenny, what are we going to talk about today? What are you feeling passionate about these days?
Well, okay. I want to preface, because you asked me what I was talking about, and I was like, let's talk about student healthcare. But I want to preface this with a story that happened to me recently. Okay, can we do that?
Yes.
Yeah.
Okay.
Please.
So, like, I'm a doctor here in Seattle, and I'm a naturopathic doctor, so I do like lots of extra stuff. I own my own business, so I can kind of do my own thing. And that's important to the story in some ways. But also, I have been watching the slow decline of availability of providers and practitioners, accessibility to care in the last several years.
Mm-hmm.
But recently, I had my checkup with my endocrinologist / oncologist for my cancer workup, because every couple of years I got to go in and I got to like get my labs drawn. And essentially the visit is like, okay, you're doing well, your labs look good, it doesn't look like you have cancer, keep on keeping on. And so it's like 3 minutes of just like checking up, and then it's like 10 minutes of me checking in on him to make sure he's doing okay. So this year I was like, man, how are things going? He works at Swedish, which is like one of the major institutions there. And he just like broke down. Okay, this is an endocrinologist who's like 64. I think he's close to retirement. So he's like 63, 64. He's like, it's bad. He's like, I'm going to retire in a couple of years. He's like, no one's going to take my place. All the doctors are leaving. All the people who are retiring are leaving. All of the new doctors just don't want to deal with the bullshit. Like, they're out of here. He's like, there's no one around. And then I was like, well, that really sucks. But also, do you have any recommendations of people who I could maybe send people to? And
where do you go?
Where do you go? And he laughed in my face, and then he cried, and he said, "There's no one." And I was like, oh God.
And this is in a major metropolitan city.
This is Seattle. Yeah, this is this is one of like an endocrinologist who's been in practice for 40 plus years.
Oh my God.
Was like, there's no one left. And I've been saying this because, like, most of the major institutions here in Seattle started shutting down access to care. And part of it was like, well, we're swamped, we're overwhelmed. And I'm like, you're like the major, like University of Washington and Swedish and all these Kaiser, all these places are like, we don't have the capacity. And I was like, well, what do you mean you have the capacity? It's just like too many people. Because now it used to be that like I could send, I mean, I'm an outside provider now in my own business, but I could send anyone to any institution. I could put their labs in, I could put their imaging in, I could refer patients over to other doctors there. They won't allow us to do that anymore. If you don't work for UW, you can't put in labs, you can't put in imaging
Like if
orders.
you're not part of their
can't-
network or their system, like if you're not part of
if you're
their
not-
system.
Yeah, if you're not in their system directly, they are accepting
Oh my
no
God.
outside referrals. And I was like, is this just too many people? But no, it's because there's not enough providers anymore. They're like, healthcare providers are dropping like flies.
And why do
it is
you think that is? Like, I mean, I know there's like, that's a very multifaceted question, right? But like, where does it start? Do you think there's a lack of a desire to be a physician, or do you think that's still fine? But then once they get in there, they're like, yeah, this fucking sucks.
This is
I'm
some
out.
bullshit.
Like,
This system that I have to navigate is broken and I'm not getting paid. And like, it's too hard to help my patients.
I think it's more the latter. It's definitely not a lack of desire to help people, because all doctors and nurses and MAs and PAs, they go into this profession because they want to help people and they think they can make a difference. I think it's because our system has been broken for a long time, but our system continues to degrade, especially with our current climate. It continues to degrade in many ways. I mean, like, I think it's multifaceted, and I have talked to many providers. I sat my 15 minutes that I get to check in on my cancer is really just me talking to my endocrinologist about, why do you think this is the
yeah. Oh my God.
I've talked to other providers in the area, and it's multifaceted, right? Like, part of it is pay, but like, where does pay come from? It comes from insurance companies. Insurance companies, I think, are a huge part of the problem. They're not paying I mean, the CEO of United Healthcare just got shot in the middle of the street. Okay. Like, there's things
Free
to
Luigi.
be said. It's legitimate, and not that happens, and not a single person that I know of was like, this is a bad thing necessarily. I mean, except for some far right people, but most individuals were like, yeah, that makes sense, because there's a lot of reason to believe that should be happening.
I think it was like, what I would say is like, I don't think people were like, I'm so glad that guy's dead, but I don't think anybody was like surprised that someone would want that to happen, right? Like, I think that was the general reaction, as everybody was
Someone's life has been so poorly impacted by decisions made in that office, and that guy's making how much fucking money a year, and these people are just like trying to find healthcare, trying to pay for healthcare, things are getting denied. Maybe someone they love died. I bet it wasn't even, I don't know, I really haven't followed the story, but I bet it wasn't even Luigi that was mad about himself. He probably wasn't even the patient. I'm sure it was.
Oh no, he was a patient. He was a patient. Yeah, he has like
chronic back pain,
scoliosis or chronic back pain or something, and he got denied something. But who knows? What
change his quality
probably wasn't even him.
Yeah.
Free Luigi.
Yeah. And
anyway,
go on. And this stuff, I mean, this stuff happens all the time. And I've actually been noticing, I think COVID exacerbated some of it, but insurance denials are skyrocketing. And there's a lot of conversation. Insurance companies are on this end being like, well, we're preventing unnecessary care. Actually, my brother-in-law came to dinner a couple of weeks ago, and he was like, how accurate is this? Like, how accurate is this claim to denial of unnecessary care? And I said, it's not accurate at all, because the things that are being denied, like the people that are actually ordering a bunch of stuff that shouldn't be covered, is very small in comparison to the stuff that does need to be covered. Like, I have a patient right now who was having this chronic cough for a long time. So I sent her in for a chest X-ray, and they saw a lesion in her lung. And they said, we can't really determine what it is because this is an X-ray. We're just looking for pneumonia. We need a CT. And so I said, absolutely, let's put in a CT, let's get it run. And the insurance is holding it up. The insurance is like, do we really need this CT? I'm like,
Oh my God.
there's a lump in her lung. Yes, we need a CT. She has a family history of cancer. Like, we need this
Yeah.
now. We don't need this to take 6 months. We need it to be now. And so
Yeah.
I have on my own time, have to spend extra time doing paperwork. I have to spend extra time calling insurance companies to get this passed through the ringer. And while I feel fortunate that I run my own business, so I buffer time into my schedule to do those things for my patients, people that work for big institutions don't have that. They don't have the capacity or the extra time to be doing these types of things all the time.
I think this, like you said, this is something that's been going on a long time. When I was fresh out of grad school, I worked at a PT clinic, and I was treating patients as an athletic trainer under a PT. And the way that we had to record what we were doing in order to get compensated for our time was insane. Like, and it's like, we're giving it, to your point, like, people aren't, I think the majority of people who are, or providers who are making these requests to whatever for their patients are not bad people. They're genuinely trying to care for their patients, right? But the number of like codes that we had to code in order to get paid, to be reimbursed for an hour of treatment, to be reimbursed $50 for an hour of hands-on manual treatment was insane. And it was easier for us to take cash patients, right? Because we didn't have to put 57, we could just care for them, right? And then it was like, to the same point of like, and I've told this story before, where we had a Parkinson's patient who they gave us 8 visits for. When you know, like,
because someone's going to get over Parkinson's in 8 visits.
In 8 visits. And to your point, because we were who we were, and because I was there, I would write in insurance like requests, additional insurance requests with like, I mean, I was like a fucking lawyer. Like, I had evidence, I had like research studies, but I took extra time, my time that I wasn't getting paid for, to do that. And not a lot of people would do that, right? And then they'd be like, then they would deny it, and I'd send it back again, and then they would approve it. It took 2 times always, no matter what. And I'm like, this system is fucked. This is fucked.
Yeah.
Like, there's
like
no,
the first denial is just to see if you'll work harder.
correct.
Like, can we just say no? And like,
Correct.
Well, and now what they're doing with, especially with AI, is that it doesn't even get denied by people anymore. It's just auto denied for a majority of cases. But there are processes too. Like, I know at my end, because I have spent a lot of time trying to figure out how to maneuver the insurance, even though I don't bill insurance. I'm not an provider precisely for that reason, because I don't want to fight to get paid $50. I would rather get paid what I'm worth and then comp my time for the people that need it. And so, you know, there are ways to bypass the system. Like, what we do is we put it through, and if it gets denied, I don't even bother with the paperwork anymore. I don't even bother with the paperwork to prove. I go straight to a peer-to-peer review, which is me calling the insurance company, spending 30 minutes on the phone on hold, and then getting a doctor that works for the insurance company who goes, why do you think this is necessary? And I say, because this patient looks like they have a tumor in their lung, they need a CT. And they go, sounds good, it's approved. Like, it's
Jesus
literally
Christ.
1 to 2 minutes of my time once I get that other doctor on the phone who's a human being who's like, yeah, obviously this makes sense. Sure. But I have to sit there for 30 minutes, and I have to make the effort to make the call.
Right.
So
And
broke.
you have to have the time to do that. And to your point, like, you have to allocate time, which is time you're not seeing patients during that, right? Like,
yeah, I have to have an entire admin day where I don't see patients at all, so I can just devote it to doing this sort of thing.
what a bullshit, what a additive bullshit thing.
Hi, Charlie.
Like,
Charles Barkley's here, in case you hear the squeaking in the background, people.
Dude, I'm sorry.
I don't know.
Charlie fucking sucks right now. He needs to go to puppy jail.
Boot camp.
Is this a puppy?
Camp.
Oh, God.
Yes. It's not a person.
Yeah, it'll be soon. Like, my puppy is getting out of the puppy phase, is just lying here waiting for me. But he gets up at 11:30 because he knows I take him out at noon during my lunch break, and then he gets all up in my head. But
I have
think,
an access story.
yeah,
If you'd like to hear it.
Tell it.
So Emmy, I've been talking about this on and off on the podcast, but so Emmy, we suspect has a condition called PANDAS, which is a pediatric. Jenny, you could probably explain it better than me, but basically an autoimmune issue for her seems to be triggered by strep throat, and then it causes like 6 weeks of kind of psychiatric symptoms, and then now we're past that, and now we're having a lot of joint pain and headaches and such. And I suspected this was what was going on. I talked to my doctor. Thankfully, they took me seriously, but I was also prepared that they may not take me seriously because some doctors don't believe it even exists. So I had already started making an appointment with specialists outside of network, cash pay, because I am privileged and I have the resources to be able to do this. I'm also privileged and have the resources, and like I am not challenged by authority. Like I can have a lot of these conversations that just some people can't have. So these are all privileges that we have. So anyways, my pediatrician does take me seriously. We get referred to Stanford. Stanford lets me know we take very select cases. And I don't even know at this point what kind of doctor it is that I need to see. I just know I've been referred to this clinic that specifically handles PANDAS cases. And so we apply, and I'm on 2 weeks, pins and needles. And during that 2 weeks period, I have a virtual appointment with a psychiatrist in the Bay Area who is familiar with PANDAS. And she tells me what I need is an endocrinologist and a pediatric endocrinologist, no, rheumatologist, excuse me, and a pediatric psychiatrist. They'll manage the case together. So she says, if you don't get into Stanford, that's what you're going to be looking for. Okay. So then I end up at the doctor this last week with my other daughter thinking we have strep, and which is also terrifying for anybody who knows that their daughter could have 6 weeks of psychiatric symptoms following a strep infection. So I end up there and I'm like, okay, so we're waiting to hear if we're accepted. If we're not accepted, this is what I understand that we need. Who is there locally to see? And she said, there's no one. There is a pediatric rheumatologist in Santa Barbara, which is 2 hours from us. And she is so impacted that she just takes very select cases on. So you also may not get accepted there if you don't get accepted at Stanford. And I'm like, so what do I do? And there was nothing. There's no solution. I live in California, like a relatively decent sized city. There's no, what? Like, how is this possible? What do we do for these people?
Insane.
I mean, it's like, and because I deal with autoimmune diseases, I see this all the time. It's like you have really complicated illnesses that don't have this very specific algorithmic diagnosis. PANDAS is that way. It's like, okay, we do this test and it's positive. That means you have the disease. That's not the case for like 70% of the autoimmune diseases. They require a workup and an evaluation and then a justification for that diagnosis. And that diagnosis can be really challenging to make. And a lot of providers come together. They don't always agree on the diagnosis because their interpretation of what's happening might be different, but also add in like personal biases and that was it as well. But on top of that, you take an insurance company who is willing to deny anything that doesn't have this very algorithmic assessment. And it's really easy to say, oh, well, that's not an accurate diagnosis because now you're basing your assessment off of someone's judgment and not based off of the number that came back on a blood test. And you can justify denials. And when you justify denials that easily, then you don't get the coverage for it or the care. So then that starts narrowing the selection of providers that are willing to go into those fields because they don't get compensated adequately for their time. And so they want to help these people, but they have to spend way more time. They can't spend the 15 minutes allotted by the insurance company to assess for a complicated neuropsychiatric autoimmune disease. And on top of that, they have to then justify their need for treatment and workup to an insurance company that may or may not pay because there's nothing that's like standardized for this sort of thing. It's really complicated.
I mean, I know this is the very obvious like complaint, but it's like, how are we a society where an insurance company is dictating how we're caring for people? Like, how is that a thing? Like, how did we get
So
here? Because I don't feel like it was
I
always. I mean, was it?
I have
Was it?
no, I have thoughts on this. Okay, I've thought a lot about this because I've been in practice now for almost 15 years. Yeah, that seems like a long answer. It never did used to be this way. Like if we look at what insurance is supposed to do, right? Insurance is supposed to be something that we put our money into. And then later on, if something happens, we get that money back to pay for things, right?
Right.
And I think a couple things have happened over time. For a very, very long period of time, our medical system had mostly been focused on like wait till shit gets bad and then we treat it. Okay.
Right.
And so if we wait till shit gets bad and then we treat it, then people are funneling money into insurance. And then when shit gets bad, then insurance pays out for that. Right? Like a car
Right.
accident. Right?
Right.
Insurance is not going to cover the car insurance is not going to cover your routine maintenance of a car.
Right.
It's only going to
Right.
cover you if the car gets into an accident. Well, if that accident could have been prevented because your tires needed to be updated, they're not going to pay for your tires to be improved. Over the course of many years, people were like, I don't want to wait until I have a heart. Like, I don't want to wait until I get this like terrible disease. I want to start doing things ahead of time, and I want my insurance to be covering it because I'm paying into it. So they started
Right.
doing more checkups and more workups, and then the insurance had to start paying out for those like what are preventative or wellness type of thing, not thinking that maybe, okay, if we worked out the money ahead of time, we are actually preventing having to pay out these big, huge things. Like, why wait
Yeah.
till that person gets into a car accident and just pay for the couple $100s for the tire and not have to pay several $1,000s for a brand new car situation? So that was part of it. But then also at the same time, I think that people in general have really lost sight as to like what insurance companies actually do with the money that we give them. And slowly over time, insurance companies they started taking things away little by little. And so we just always assumed that, okay, we gave our money to insurance companies and that they would pay these things. But then things started happening, like deductibles started increasing. Okay.
Right.
So we're like paying somebody, say, I don't know, like I'll give you the example of what we pay. Okay. So for my family of 4, right? My family of 4 pays $600 a month for our insurance. Right.
Jeez.
So for our entire family of 4, we pay $600 a month. I'm part of that is because I have 2 small children and we've had a lot of ER visits and I have pump cancer and stuff happening. Okay.
Yeah.
So we pay $600. Now, if we also have a deductible that is $2,000. So if you take that like $600, what's that? 600 times 12, that's $7,200 per year that we pay the insurance company, plus $2,000 per year in deductible before the insurance even covers anything. We are paying the insurance company $9,000 to $10,000 a year before that insurance even covers any of our costs. Okay.
Right.
So we kind of stopped paying attention because we thought the insurance companies were working for us. They were. But as they started increasing our deductibles and then they started taking things away, like they would pay out for labs before you met your deductible. But now you have to meet your deductible before they start paying labs. They used to pay out for your prescriptions before you met your deductible. Now they like say, okay, well, some people have to meet their deductible before their medications get covered. Right.
Jesus
and so
Christ.
they started slowly over the years just taking away rights. And so now we're in a place where I'm like, okay, I'm going to pay $10,000 a year to my insurance on the off chance that my children, who seem to be prone to falling into shit, will go to the ER regularly. And I am hoping that I have more than a $10,000 bill so that I am eventually paying less than $10,000 for the year.
And then at least what I saw, and maybe you see this too, is, and you see these astronomical bills that come to you, right? But part of that is that hospitals and doctors and whatever have to charge more because what they're getting reimbursed for the actual care that they're giving is so much less. Like the example of the PT clinic, right? We would get $50, but we would quote unquote have to charge over $300 for that visit to bill to the insurance company would be $300, but we would only get reimbursed $50 for that visit. But if you sent that bill to the patient, it looks like, well, why are they charging me so much? And it's like, everybody's getting fucked by this company. Everybody's
It
getting
is.
fucked.
And I think that's also something that a lot of people don't know either, because they don't see it on the side, right? This is one of the reasons
Right.
why I chose not to take insurance, because
Yeah.
when you as a provider, when you contract with an insurance company, you are bound by the pricing that you say to the insurance company, because the idea around insurance is that you get a quote subsidized price. Okay? So if I say I charge $300 an hour, and the
Mhm.
insurance company goes, okay, well, we're going to send you people, but they're not going to have to pay $300 an hour. They're going to pay $150 an hour. Okay, so they get the discounted rate. But
Mhm.
the problem with this is that they're only going to pay me $150 every time I see a patient for an hour, even though my time is worth $300 per hour. So in order to get my $300 per hour, I have to then renegotiate with the insurance company and say, I actually charge $600 an hour,
Right.
so that the discounted rate for the insurance is $300 per hour.
Or you have
So
to
you're
see more
getting the rate.
patients, right? Like that's where doctors get
Yeah,
into these 15-minute, like 5-minute visits, right?
correct.
Because
Yeah.
you just have to
They
crank
have
them
to
out.
Actually, most insurance companies now won't even pay providers past that 15 minutes. And so you have to then make extra justification. So in order to stack patients at a 15-minute increment, you will get the most money for the short amount of people, the amount of people that you're seeing, without having to do extra work on top of that to justify that you needed that extra 10 minutes with the person.
Oh my God.
But then on top of that, the other shitty part about the bumping up pricing to get paid what you're worth has to do with this thing called fee splitting. And so what ends up happening is that, like, if someone comes into that provider and they say, okay, well, you don't take my insurance, or my insurance isn't contracted with you, I want to come see you. That person who comes in has to then pay the $600 per hour, because if a doctor said, no, I'm only worth $300 per hour, you can just pay me the $300 per hour, the insurance company goes, wait a second. You
Yeah.
lied to us. You told us you were worth $600 an hour. You're really worth $300 an hour. And so if you're really worth $300 an hour, now you have to back pay me, the insurance company, all that
Jesus.
extra money we paid you for you lying to us about how much you were worth.
What the
That's called
hell,
fee splitting.
man?
I think there's a lot of things that we can do. So from a provider perspective, my goal has always been to educate other providers as to like what's happening with the contracting insurance. So I don't bill insurance, and a lot of people will look at me and say, okay, well, you don't take insurance, and that means you're just paying you cost, you're part of the problem, which that is not true at all, because I'm not contracted with insurance. People can pay me whatever they can pay me, and I choose to work from that moral compass. So like I say, my fees are $300 an hour. And if someone comes in and says, I really want to see you, but I can't afford $300 an hour, I can say, how much can you afford? And they can say, I can pay you 75 to 100 bucks. And I say, okay, that's fine. Because I have the power now to subsidize any of my costs. And I can do that because I am, most of the time, 75% of the time, making what I'm worth. And I don't have to fight for it, and I'm not wasting my. And the other part too is that, I don't, when people submit, like, this is another thing people don't understand, is like, if people come see me as an out-of-network provider, most of the time they can take their insurance, but take the super bill from my visit and then send it to the insurance, and the insurance pays them. And the insurance company cannot legally request my chart notes or try to justify the cost for that, because I'm not contracted. So they have to pay out what they were contracted to pay. Now, insurance companies are starting to get aware of people doing this, because they're starting to change deductibles for out-of-network versus in-network and things like that. But it's a little bit more, quote, expensive, but you can still get reimbursed. So like, from a provider standpoint, it's providers understanding that actually out-of-network care is better for the patient all around, because you can subsidize your costs easier, because you don't have to bump your prices way higher to get adequate compensation. And you
Right.
can provide overall better care without having to spend all this extra time justifying what you're doing. On a patient level, it's just education around what your insurance company is doing. Like, don't just blindly sign up for insurance. You should understand what your insurance plan is getting you. And if that insurance plan has a really high deductible or it's not covering the people you want to see, don't pay for an expensive plan. Pay for a catastrophic plan, and you'll pay less for the insurance, and then just go pay the people you want to see out of pocket. It'll be cheaper that way. Like way
get an
cheaper
HSA or
for you.
something. You
There are
put
lots-
money. Could you just put money into an HSA, like, and
Yeah.
then use that to cover your costs? Like,
Yeah. So HSA plans are becoming really popular now, where like people they'll do a high catastrophic HSA plan where they're just actually putting their money into like a high yield savings. And you can actually take your HSA and invest it in the stock market, and it'll have a higher yield of return rate for you. So you're making money off it. And then you can use that money for all your healthcare needs. Like, it just goes straight back to you. And then you're paying less just straight to the insurance company for whatever the fuck they're doing, which is never.
dude.
And then, for me, like, if it was just, and I tell my patients this all the time, it's like, yeah, if you're a single person and you don't have a family, you're not worried about your kids or whatever, and you don't have a lot of health issues, you can get a catastrophic plan, and maybe you're only paying $3,000 to the insurance, and maybe they don't cover your labs or your medications or your doctor's visits, but you're not going to pay $7,000 in that stuff anyway, because nowadays there are cheaper ways to get cheaper medications, like GoodRx, and then there's like Simple Care and Amazon, and like it's cheaper to just buy the medications directly from wholesalers. And then, or doing labs, you can order labs from lab companies that have contract with insurance, and they're wholesaling their costs, and it's way cheaper than using major lab companies. It's like, instead of LabCorp charging $60 for a CBC, you can get it for $5 because that's how much it costs.
Oh my God. I'm going to ask you something, because I saw this, maybe you know this, I saw this on a TikTok, and I don't know if it's real, but Jenny, we love TikTok, but
TikTok has disappointed me lately, so we'll see.
Dude, TikTok is terrible now. Anyway,
that's another conversation we can talk about.
I want my Chinese spy back. Anyway, so I saw this TikTok. Tell me if you know if this is true or false. So it was like, don't pay your medical bills, and I was like, okay.
I've seen this. Yeah.
Okay, so the concept is, don't pay your medical bills, have them send it to collections, and then when collection calls, you say, selling medical information and personal information to a third party is a OSHA, what is it? OSHA, HIPAA violation.
Yeah.
And they're like, oh yeah. And then it's wiped away.
Yes, true. That's true. Yeah. People who have large medical bills. Yeah. People who have large
because
medical
doctors
bills
already got paid, right? Like, the doctor already got paid for the service that you provided, right?
Yeah, the organization that doctor is employed by will pay that doctor no matter what. Like, that doctor is getting a salary, okay?
Yeah.
It is the organization's own responsibility to collect on whatever extra money they get from the insurance companies to recoup their cost of those salaries they're paying those doctors. Most of the people, though, that get kind of shammed by it's not the doctors, it's like the nurses on the end. It's the people lower down on the totem pole that actually do most of the work anyway, that are getting benefits taken away, and they're having to work longer hours for less pay. Those individuals are having to recoup some of that cost that doesn't get paid out to the organization. And yeah, it's not, but still, I mean, you're paying overpriced amount, and most of the time, and here's another thing that I don't think they talked about on that TikTok, but most big organizations will just take whatever money you can pay them, okay?
Mm-hmm.
So a lot of times, if you have a big bill, you can call and just be like, I mean, it takes time and it takes effort, but a lot of times you can just say, okay, I can't afford this like $7,000 bill, and then they say, okay, how much can you afford? And it's bargaining. And you say, I can pay you $500. And they say, we need more than that. We need $2,000. And you say, I can't pay you $2,000. I can pay you $500. And it's like this back and forth, and you hold to your guns. And eventually they'll go, okay, we'll take your $500. And then most organizations will wipe it clean. And
Wow.
because they don't want to sell it to collections. Like they don't want to have to do that either. They would rather just, because they're going to get so much less money from collection. If they're selling your debt to collections, they're probably going to get less than what they could have got from you anyway. And so if you can just say, I only want to pay you $500 or $200 or whatever, they'll take it eventually. But you just kind of got to
Wow.
push numbers and push them a little bit hard.
So when I was first diagnosed with kidney disease and I had to have the medically necessary termination, there was a clause in my insurance contract that said, regardless of medical necessity, they would not pay for a termination of pregnancy. So I ended up getting a $22,000 bill from the hospital to pay for that, plus the other subsequent bills from the providers, the anesthesiologists, etc. Anyhow, got the $22,000 bill and I'm like, no, we're not doing that. So we negotiated with the hospital and we got that down to $2,200.
Wow.
But I bet you could have gotten it lower than that.
Well, and let's remember what I was going through at that time. I had just been diagnosed with a chronic illness, no cure. I found out I was pregnant and that it was not safe to keep that baby that I desperately wanted. I felt like dog shit because I was unwell. And now I have to go through all of these hoops. And remember too, I'm employed. I'm white. I have financial stability. I have parents that can back me up financially if needed. I have a partner. I don't have a problem challenging authority. Some cultures, some people they look at doctors, insurance as this authority figure that they can't talk back to, they can't request things of. And what position are they in these scenarios?
And like, if we think about America, right? Like, again, like Cheryl, you acknowledging all of your privilege, right? Like, think about the fact that like English is your first language. You're educated. You have a higher education, right? You have lots of probably more financial stability than a lot of people, right? And that was, with all of those things, that was really challenging. And then we think about all the other people in our society who don't have those privileges necessarily, or who aren't taught that you could speak up, or if you did speak up, it wasn't good for you, you know?
I mean, and there's also like discrimination as a whole. Like someone who is not white, when they call an organization to negotiate a price, they are going to be less likely to get a better price just purely based off of discrimination. If that person on the other end of the phone is like, oh, I can tell you're not white, then I am less likely to give you a deal because I'm going to pass a judgment on you that you're just like ganking the system or whatever.
Yeah.
It's you're going to face those forms of discrimination also, and it will be harder. It will just be physically harder, mentally and emotionally exhausting.
Jesus. Man. Okay, so things we can do is we can negotiate these bills. We can put money into your HSA.
Yeah, and talk about these things, like, because we only know what happens in our individual rural household. We're not going around and being like, my family spent $24,000 in health insurance this year, or like my family, like comparing what other people are getting, because health insurance plans are like salaries. You don't know what the other person got offered. People in a workplace environment will not have the same insurance. In fact, different workplace environments get offered different types of plans. Some people get offered, better plans than others, in big organizations or whatever. So having the conversations and understanding what other people are getting versus what you're getting will also help you to realize the different options that there are, and like how you can make changes to get yourself into a better position when you're not sick and dying.
Yeah. I also want to just add to what you're saying, Jenny, is like, you can also negotiate with your company how much they contribute to your HSA. And like that can be huge, right? Because that's money pre-tax that's going into your HSA that maybe they're matching or whatever it is. Pete and I are in a position where potentially in the next couple of months, we're there's going to be a change and we might need to get our own insurance. We've always had insurance through his company, right? I have no idea what we pay him for insurance. Literally no idea, because it just comes out of his check, right? Like,
Yeah.
we don't see it, and now, like, you saying this, I'm like, shit, like, we've never had to be responsible for our own insurance in that way. We have been, but it's always been like, and I think a lot of people think that way. Like, when you're with a corporation that provides benefits, you're like, it doesn't even feel like money, but it is money that's coming out of our check that we just don't see, right? But it's like, it's you just don't think about it. Like, it's like fake money.
Yeah.
You're not thinking about it.
I'm more detached from it too.
Yeah.
And, in regards to the HSA, that point about the employer contributing is important, in that individuals are only allowed per federal regulation to contribute so much to an HSA. I can't remember how much it is, but I want to say it's like around $1,200 a month per individual.
Mm-hmm.
So if you want more money in your HSA, you have to get it matched by an employer to contribute more, potentially more.
This is one of the benefits we've been exploring when we were considering the type of entity I should own my business in, whether I should be a sole proprietor or an LLC, S Corp, because I can, as an employer to myself, because I own a LLC and I employ myself, I can provide more into my HSA for my family, of a benefit for our family.
It's better for employers, from what I understand as well. Like, at least I know in a lot of the companies that my husband has worked for, they push the high deductible plan, right? And they're like, but guess what? We're going to put some money in your HSA, right? Like, we'll match whatever you put in your HSA.
Yeah. And it really depends. I mean, as an employer too, like, having to offer health insurance to my employees has been a nightmare. Like, we calculated it. We were trying to figure out this year if we were going to continue offering health insurance, if we were going to put it straight into a high yield savings for them to use. Because last year, I mean, I paid out, it was $400 per employee for a plan. And I had an employee that had a baby, and that insurance plan of me paying $400 a month for her insurance didn't even cover her pregnancy. So, like,
oh my
why
God.
am I paying them $400 to $500 a month if it's not? She had to then apply for the state health insurance, so because it would cover it all. Because in Washington, we have like a state health insurance that will cover pregnancies at full time. And I'm like, why was I even paying that money to the insurance if it wasn't even going to cover you being pregnant?
I had 3 babies in 4 years, right? So we were always meeting our deductible, right? We had a higher deductible, but like, it was always something we never really were thinking about. We were just kind of doing, because you were just always in the doctor, always going to the visits, always meeting your deductible. And then now we're in this point where, we have 3 kids, but like, we're just going for wellness visits, and we're going occasionally to the urgent care ER down the street, because the kids never get hurt during regular business hours, right? Yeah. It's like, oh, you got strep throat today on Sunday? Cool. I guess we'll go to the urgent care where they're going to charge us $5 billion. But it is something we need to pay attention to. And I'm like, very honestly, it's not something I pay attention to. And I'm only now thinking about it now because we're going to have to potentially switch to having our own plan. And if we really think about the money that you're throwing away to these insurance companies.
Well, and that's my biggest, that's my biggest encouragement to people though, is like, if you feel like you're one of those people that's in that state where you're like, oh shit, I wasn't even thinking about this.
Yeah.
It's time to start thinking about it, because what you don't want to happen is that you have to start thinking about it when it actually matters. And that's where people, like what Cheryl was bringing up, is like, when you are really sick, when you get that bill for $22,000 because you had to have a pregnancy termination that would save your life.
Right.
And then your insurance wouldn't cover it. Like, you don't want to have to deal with it while you're in that emotional, physical, and mental state. So, like, do it now. Think about it now. Even though it seems automatic, this is the trap we got put into. We think it's automatic, but we should actually be looking at those details now.
Okay, Jenny, we know people are going to want to connect with you, and we know you're kind of TikTok famous these days. So where can people find you? How do we connect and learn more of your knowledge bombs?
I'm on TikTok mostly, so you can find me at Dr. Jenny Bennett on TikTok. I took a little break after the blackout, but I'll get back into it. I'm still leery that we'll do it.
Did
I'm
you go to
also on
Red Note?
Instagram and no.
Oh, Dr.
I
Jenny.
didn't. I know. I think I'm gonna do Substack and
Oh,
YouTube.
okay.
I'm branching. I'm gonna branch out a little bit. I even know some Mandarin, but I couldn't do that. No, it was too much. I tried. I logged on. I was like, nope. I'm good. I still do appreciate TikTok, and I'll do most of my videos there as I'm like working on transition. So I am trying to desperately get off of Meta. I cannot stand anything Meta related, so I'm really shifting gears from more. But yeah, mostly
Yeah.
TikTok, Dr. Jenny Bennett. My business is Aria Integrative Medicine in Seattle, but you could also just Google me, Jenny, Dr. Jenny
Google
Bennett,
me.
Seattle, and I'll come up.
Oh my God, that's only
always
really
wa-
regional. Oh my God, I have to tell you. So this is just a regional thing in Indiana. Our IU basketball coach here was like a new coach this year, and they're like, blah, 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 blah. He's like, I win, Google me. So now there's shirts all over Indiana that's like, Google me. So when you said that, I was like, oh my God. Anyway,
It's like I always wonder if my ex-boyfriends ever Google me.
absolutely they do. I Google myself.
Dr. Jenny, thank you so much for being here. You are always such a wealth of knowledge and information, and we appreciate you so much.
I appreciate you guys having me on, and it's always a pleasure to talk to you guys.
Likewise.
Yeah, we will.
That's a wrap.
Bye.
Thank you for joining us on this journey of laughter, life, and growth.
And remember, you're not alone on this path to success. We're right here with you every step of the way.
Please remember to hit that subscribe button so you never miss an episode. And if you found value in today's conversation, we'd be thrilled if you would leave us a review on your favorite platform. Your feedback means the world to us.
And don't forget to share this podcast with your friends, family, and anyone who could use a good laugh and some practical insight into navigating the challenges and triumphs of our minds, body, soul, and business.
Remember, we're doing this right.